Professor Exodactylis. Hi, I'm Eric. How are you?
Hi, Eric. Good to see you.
It's great to see you too.
Good to see you. What are you doing?
I've come to say goodbye because I'm actually
Really?
leaving the department.
Oh, what a pity. Where are you going to?
I'm off to Australia.
Australia?
Yeah.
Wow, that's
as
far.
a fellow in emergency medicine. But I had a couple questions because in Australia, I'll actually be doing a lot of teaching, and I wanted to know if you had some knowledge that you wanted to.
That's great. That's fantastic. Okay, let's go and discuss.
Yeah, let's do that. Yeah, I had a couple questions just about emergency medicine.
Please come in. Please come in.
Thank you.
And let's discuss it. Thank you.
Well, I just basically, I'm in the situation where now I need to do some teaching to medical students.
That's good, yes.
And although my job is very clinical, I'd like to know what you would, if you were my age, what would you like to know now that you have acquired more experience than I do?
Oh, thank you. Thank you, Eric, for asking me such a question. I'm really delighted and honored to give you some advice. A couple of years ago, I was thinking about putting together 10 commandments in emergency medicine.
Okay.
Right? 10 commandments, like from the Bible.
Yeah.
It's theory.
Yeah.
But if we would stick to those 10 commandments, actually, this world would be a better place.
Okay, all right.
So those 10 commandments in emergency medicine, if we would really stick to them every day in our daily practice, I'm pretty sure would make our emergency departments, emergency rooms, resuscitation rooms like this one, a better and more successful place.
Okay, yeah.
Do you want me to
I'd
go
love
through?
That, yeah.
Okay,
10
great.
commandments.
10 commandments, okay. The first one is the Know Your Alphabet commandment.
Okay.
You know the alphabet. What is the alphabet in emergency medicine?
A, B, C, D, E.
Absolutely, absolutely. It is so simple. We all can spell A like airway, B like breathing, C like circulation, D like disability, E like environment, and then I added the F, and F stands for fall. And is there something else you would like to add, Eric?
I don't know. Would F might also be, you mean in terms of F, maybe fertility? Or
fertility.
well? Yeah.
Very good. It's falls.
Yeah.
So falls, so prevent falls in the emergency department. Okay, that's F. And do we have a G?
I think we definitely have a G. Yeah, let's add a G. I don't know. Gravity for falls, maybe?
Gravity or glucose?
Or glucose.
Glucose
could also be one that's important. Yeah,
glucose.
I agree with that.
Okay, so know your alphabet. So
yeah.
This is my first commandment, Eric. So if you teach your students that they have to follow this simple A, B, C, D, E, F, G rule, I'm pretty sure that they will be more confident in treating their patients.
So staying easy and very simple ways to remember things.
Absolutely,
that's an excellent point.
absolutely,
Yeah.
absolutely.
Okay.
And don't forget simple things. What would be an airway?
Well, yeah.
Airway without oxygen.
That's
okay?
true.
And oxygen, that's why it's so important to check the oxygen all the time. Check that you have enough oxygen to run your airways.
Yep, good point.
Because this is one of the biggest mistakes, and it's a fatal mistake as well, to go on a ride through the hospital without a full oxygen bottle. So know your alphabet and check your equipment.
Okay, all right.
I want to talk to you about my second commandment, actually. And the second commandment is called Every Patient is Trying to Die. Can you imagine what I want to say?
That people might be hiding something that we couldn't see with the apparent eye?
Absolutely, absolutely, absolutely. If a patient comes to the emergency room, it's good to be positive, but you have to assume the worst. Because it is our duty and our job in the emergency room to rule out any fatal diseases or injuries.
Mm-hmm.
And we can do this with the help of an ultrasound engine. Have you used ultrasound before?
I've used it a couple times, yeah.
It's very important. For example, if you have somebody with pain in his abdomen, or a trauma patient, you have to use your ultrasound machine, because unfortunately we are unable to look into a patient. But with the help of this machine, and this is very, very easy to use, you can look into the patient organs and rule out, for example, an hidden injury to the spleen, to the liver, or any bleeding. Okay?
Yeah.
Good. So number 2 is every patient is trying to do, and let's rule out the worst and not assume the best. Remember this office, Eric?
I do actually, yeah.
You were sitting behind those computers for many hours.
Yeah, that's
And
right.
it's so important, and that's why I want to talk to you about the commandment number 3 and 4.
Okay.
And both are about documentation. Number 3 is that you have always to document what you have discussed with a patient. That's very important, okay? So if the patient wants to go home, you have to document it, because that can be of high legal impact.
Okay.
Okay? Some patients want to leave. It's their right, but you have to document it. And number 4 is that do not document only your positives. Also document your negative findings.
Yeah.
We always document too little of everything. But at the end of the day, you have to find the right balance between positives and negatives findings in your documentation.
Yeah.
Okay? That's number 3 and 4.
Okay.
It's all about documentation. Eric, let us talk about commandment number 5. And I call this commandment, never trust your laboratory results. It's very
Okay.
important, because what is this?
It's a blood gas machine.
It's a blood gas machine. Are we treating the blood gas machine, or are we treating the patient?
Definitely the patient.
Definitely the patient. The blood gas machine, like any other machine, is a tool to help us to get a better clinical picture. So you have to be aware that your probe can be wrong, the machine can be wrong, okay? Your results can be wrong, okay? So always remember, try to make sure that you order the right test for the right patient and put both of them in the right context.
Yeah, that's a good point, actually. To keep in mind that we're treating the patient
Absolutely.
and not the machine.
Absolutely. That's number 5.
Yeah.
Eric, do you know my commandment number 6, how it's called?
No.
It's called V's for victory and V's for vital signs.
That's good, yeah.
Okay? Because managing the vital signs means victory over death and illness. Now, this is a standard monitor we have worked so many times with during your training. So what are the 3 most important vital signs you can read on this monitor?
I'd say probably the heart rate, maybe the blood pressure,
Absolutely.
and the saturation.
And the saturation. Now, what is wrong sometimes with the saturation?
Sometimes you don't get a good reading, or it starts to beep like this.
Exactly. It starts beeping, exactly. All those monitors have alarms. They go off all the time. Sometimes they do not go off. So we have to check. But the problem with SpO2 is that you need a finger, obviously.
Yeah.
You need a warm finger.
That's
okay?
true. Hypertension. Yeah, that's right. That's right.
Exactly.
Hypothermic patients,
Because
yeah.
a cold finger is absolutely useless. You need enough blood in your finger so that the probe can pick up. So sometimes people think, oh wow, oxygen saturation is bad, but it's not. It's only the finger which is cold.
Yeah.
Okay? Or it's the bleeding, okay, which is causing hypotension and not enough pressure in the finger
That's true.
for the probe to read.
So the perfusion is low.
Exactly. So SpO2, Eric, is a great tool. We use it every day. But it's very dangerous if you misinterpret the results. So always make sure that you have a well-perfused, warm finger or earlobe or nose or whatever, and always try to put it into a context with the clinical picture of your patient.
Yep. Okay. That's a good point to teach as well.
The next commandment is the magic number 7, and I call it blind trust.
Mm-hmm.
So blind trust, as I always say, is as bad as blind love. Any idea what I mean with that?
To not forcefully trust others, but to actually...
Yeah, exactly. How many times we ask for a consult? But don't forget, doctors who come down to give advice to you are usually the youngest one, are the ones they send down to check the patient and to give you advice. So never switch your brain off.
Yeah.
Always keep thinking and always put the advice of others into your own clinical context.
Yeah.
Another very important commandment is number 8, Eric, and it's called learn from your mistakes. Never blame the whistleblower. Always try to learn from your own mistakes or from the mistakes of others, because this is the only way we can learn, we can progress, and we can get better. Everybody makes mistakes at some stage of his career. Our medical history, our path is full of mistakes, but this is the only way to get better and to treat our patients better. So, learn from your mistakes is number 8, and it's very important. Eric, I would like to talk to you about the commandment number 9. And this is maybe one of the most important commandments.
Okay.
And that's a very, very important advice I want to give to you and to your students. Always treat your patients like you would treat your own family. Always show dignity, always be as reflective as possible, and always understand that you are not treating an illness, but that you are treating a human being. Okay? So that's very, very important. And maybe this is one of the most important commandments I would like to share with you. Eric, let us talk about my last commandment,
Okay.
number 10.
Okay.
And it is called always follow up your X-rays and lab results. It is so important, that you never forget that the patient is still your patient, even if he left your emergency department. And about 20%, does the literature say, 20% of X-ray results we do miss during the initial phase
Okay.
of examining the patient. So you can be wrong, the radiologist can be wrong, both of you can be wrong. So maybe there is more information after a day or so. Radiologists used to look at their X-rays together with their seniors a couple of hours later, and then they type their reports into the computer program.
Yeah.
So keep track of your patients, of your trauma patients, and check the results a day later. Okay? Very important. Never forget the patient is still your patient, even if he left your emergency department.
Okay. Yeah.
So Eric, I really hope that I was able to give you some advice. Those 10 commandments are really easy to follow. So if you memorize them, if you teach them to your students, basically nothing can go wrong. So I wish you all the best in the world, good luck and a bright career, and thank you for being such a great doctor in my department.
Thank you very much.